Jake, so much for joining us today. Can you get started by sharing a bit about your role and what Healthier Colorado is?
Yeah, I'm Jake Williams, CEO of Healthier Colorado. I've been doing this for 10 years since the beginning of our organization. Healthier Colorado is dedicated to advancing public health in Colorado, especially from an equity perspective. And what that means is primarily through the public policy process. So stuff that happens on the ballot, stuff that happens down at the state capitol, stuff that happens in cities and counties across Colorado. We want to give every Coloradan the chance to live a healthy life. Sometimes that means addressing housing or nutrition or health insurance. All the things that influence your ability to live a healthy life is stuff that we're concerned about. We organize our work into mental health, physical health, and what we call social health. So social health would mean that people have equal access to what are sometimes referred to as the social determinants of health, everything from education to housing, et cetera.
Thanks for all you're working on. Can you share a little bit with the RMMFI community what Healthier Colorado's advocacy priorities are for this legislative session, knowing that we've only got a couple of weeks left? What are you all working on and hoping to see?
We have a lot of exciting and hard-fought campaigns going on right now, including many that would concern entrepreneurs, beginning with a bill that we are running that would auto-seal, if you will, eligible nonviolent criminal records for people when they exit the criminal justice system so that they can access employment, housing, education, etc. People deserve a rightful second chance. Government red tape shouldn't get in their way. And so we want to pass a bill to make sure that those eligible records are auto-sealed so they can access those opportunities. That's House Bill 1133. So that's one we have in process right now. Another one that people may be concerned about just as concerned citizens, or perhaps a parent, or for any other legitimate reason, is the use of social media by youth. And specifically, we want to address the impact of this use on their mental health. So we're running a groundbreaking national first bill on this topic that would place new regulation on social media from you using social media for a long time, including increased risk of anxiety and depression. Maybe think about not doing that, because studies show that social media significantly impacts youth sleep, and then that has knock-on effects for both mental and physical health. And also, this bill would create new resources that would be at the Department of Education and then distributed throughout the state for both parents and kids so that they can learn how to safely navigate these platforms. That's our second priority. Then we have childcare, which absolutely should be a concern for any entrepreneur, employer, employee, and many other stakeholders. We want to improve access to the state's low-income childcare assistance program. We have a bill right now that would do that. It would help at least 16,000 families better access this program so that they can literally afford to go to work. I think it's obvious how this would be of interest to entrepreneurs and employees. And hopefully, despite the fact that we're in a tough budget environment here in Colorado this year, we can get this thing across the finish line. And then finally, we are advancing a bill that would modify our Medicaid program. So our Medicaid program, just like in every other state, is focused on low-income people and people with disabilities. In this case, what we want to do is make it possible to use Medicaid funds to cover housing and nutrition services for people. I think it's pretty obvious to most people that having a roof over your head and having nutritious food to eat is key to health. And we think these are critical needs that deserve reimbursement by Medicaid. So often we, mistake health for just the stuff that happens in the doctor's office, but we both know intuitively and through research that actually so much of what happens outside the doctor's office to keep people healthy in the first place is even more important and cost efficient for taxpayers as well. So that's why we're running this bill, to make it possible for Medicaid to reimburse when it comes to housing and nutrition.
Can you share a little bit more about how the RMMFI community can learn more, can get involved, and really share their voice and their story as these bills are moving forward?
So first, you can learn more by going to our website, healthiercolorado.org. And what we do actually is put up on our website all those bills that I mentioned and then some. If you go to resources and then 2024 legislative priorities, you'll see a list that's auto-updated on the back end. So you see like where it's at in the process, read the bill itself, what the vote count was in its last committee, for example. And if you want to get involved, you can just email me if you want. It's jwilliams@healthiercolorado.org. There are ways on the website you can get involved as well, but feel free to just email me and I can plug you into the right place. Really, what I like to tell folks, whether they're entrepreneurs or engaged in any walk of life, legislators want to hear from real people. I'm not a real person. I'm paid to, work within the public policy process to advance a specific agenda. And what I say matters to a certain extent, but what's more valuable is for legislators to hear from people doing the work out in the community whose full-time job isn't necessarily to lobby the legislature to achieve a certain aim. So how you can contribute includes showing up at the Capitol to provide testimony, writing letters to the editor or an op-ed, doing a video like this that we use on social media. There's many ways that you can help. And so, like I said, email me at jwilliams@healthiercolorado.org and I can steer you in the right direction.
Awesome. Well, thanks, Jake, for being so accessible and for the reminder that we all have a voice and a part to play in this process. I really appreciate you and everything that Healthier Colorado is doing.
Thank you.